Hi, everyone. Welcome to Data RX, AI in Tech and Healthcare, the place where we connect AI, technology, and healthcare to tackle the industry's biggest problems. I'm Casey Harden, an informatician with a passion for uncovering the truth behind the data. But you might be wondering, what exactly is an informatician? Basically, I'm someone that uses data and AI as tools to expose inefficiencies, create solutions, and help patients get better care. And if that sounds complicated, don't worry. I'm here to break it all down so it's easy for anyone to understand. With a master's degree in health informatics, a year-long graduateship, and practical experience as a program evaluator and data analyst, I've developed strategies to make complex healthcare decisions faster and more transparent. But I'm not here to brag. I'm here to show you how you can use AI to solve real-world problems. When my 11-year-old son told me using AI felt like cheating, I knew we needed to change that mentality. AI isn't cheating, it's an assistant. Just like a stethoscope for a doctor helps them listen, AI helps us think bigger and faster. And if we don't master it now, we'll be left behind. This channel exists because healthcare is broken. The United States spends more on healthcare than any other country, but still, millions struggle to access quality care. Right now, I'm testing AI tools like ChatGPT and DeepSeek to see which is better for predicting emergencies, cutting costs, and exposing waste. Spoiler alert, the data will surprise you. If you're ready to turn AI anxiety into action and join a community of problem solvers, hit subscribe. Together, we're going to heal healthcare one algorithm at a time.